ఇదేం వైరస్ ఇంతగా ఇబ్బందులు పెడుతోంది? ఈ పీడ ఎప్పటికి వదులుతుందో? పల్లె పట్టణం అన్న తేడా లేకుండా అంతటా ఇదే అసహనం. రికార్డు స్థాయిలో కేసులు మరణాలు నమోదవుతున్నాయి. సెకండ్ వేవ్ తీవ్రత ఎందుకింతగా ఉందో అర్థం కాక సతమతమవుతున్నారు శాస్త్రవేత్తలు. ఈ తీవ్రత అంచనా వేయటంలో ప్రభుత్వాలు విఫలమయ్యాయన్న విమర్శలు వెల్లువెత్తుతున్నాయి. ఈ అంచనాల సంగతి పక్కన పెడితే అసలు ఇప్పుడు వైరస్ నియంత్రణకు విధానపరంగా తీసుకోవాల్సిన నిర్ణయాలేంటి? ఎలాంటి జాగ్రత్తలతో వైరస్పై విజయం సాధించగలం? ఈ ప్రశ్నలకు సమాధానాలు ఇస్తున్నారు పలు విభాగాలకు చెందిన నిపుణులు. ఎబోలా కట్టడిలో కీలక పాత్ర పోషించిన డాక్టర్ రణు థిల్లర్, పేషెంట్ నో హౌ .com వ్యవస్థాపకుడు దేశభక్తుని శ్రీకృష్ణ, మధ్యప్రదేశ్లోని గ్రామాల్లో ప్రాథమిక ఆరోగ్య రంగ సేవలందిస్తున్న అదృష్ భద్ర ఈటీవీ భారత్కి ఇచ్చిన ప్రత్యేక చర్చలో పాల్గొన్నారు. కరోనా కట్టడి చర్యల నుంచి మాస్కుల వినియోగం వరకు అన్ని విషయాలను వివరించారు.
Hello and welcome to this special on ETV Bharat. India has been facing an unprecedented second wave. And what can be done from the policy front? At the same time, what is the kind of precautions that we need to take? That has been in the minds of a lot of people who have been on the field and trying to mitigate the crisis at hand. To discuss more about this, we have an empowered panel of guests who are joining us and who will give us insights as to how probably India can face the current situation. The first question, of course, goes to Dr. Ranu Dhillon. The question over here is not about having good medical knowledge and good medical facilities. It's also about policy decisions. And you have seen the kind of situation India is in. What would be your first advice to the government?
Yeah, I think right now, given the catastrophic transmission that's happening and the overwhelming of not just the health system, but even households who are caring for sick family members and who are having family members pass left and right. What really needs to happen is a comprehensive and very aggressive response. And so far, a lot of the discussion has been around bolstering treatment capacity. That certainly needs to happen, but that will take time, as will vaccination. So those efforts need to be made, but we also need to be doing a lot more to slow down transmission. Transmission can increase exponentially. Increasing resources to manage more people getting sick can only really happen incrementally. And there's a lot we can do, which we'll get into, using masks, deployment of rapid tests, and also doing better home-based triage and management of people who might be infected with COVID.
Well, Dr. Dhillon, now you have in fact had 15 years of experience on this and you've been managing health systems in low and middle income countries. Now, with regards to India, probably we cannot define India when it comes to low or middle income countries, how you can put them in one general category. Over here, what we are looking at, probably different areas of India have got different responses. So it's going to be very difficult when it comes to actually having a uniform policy. So when do you think this is going to be the challenge for the government?
Well, from having worked in various parts of India myself, including Jharkhand, as well as in some of the relatively better off areas around, let's say, Hyderabad, and also working with Dr. Adrish in rural Madhya Pradesh, of course, there's a huge variation. So a one size fits all is not really something that's possible nor wise. And so much of what has to happen has to be tailored to the local areas. But from the standpoint of stopping transmission and dealing with COVID, there are some universalities that are not just generally applicable to transmission in India, but even globally. And that includes better masks that can protect people when they're in crowded areas and indoors from emitting infection as well as receiving it. And that's something that applies to rural Madhya Pradesh the same way it will apply to a wealthier neighborhood in Delhi. And so there are aspects like that that can be applied across the board. Similarly, rapid diagnostic tests. These are tests that ASHAs, community workers, and even people themselves can administer on themselves to determine if they might be infected and capable of infecting others. And the idea is if you're doing these tests on yourself, ideally every few days, if you're finding out that you might be positive, you can then take the measures to isolate yourself. And of course, if you start having symptoms, you can then pursue care before things get much worse. That's something that can apply across the board. Policy can be developed that can envelope that. And then the particulars of how to execute on the ground is going to really be where state level, and I would even say more so district and block level officials will be in the driver's seat to really drive through how we get this done. And of course, tools can be developed that can be applied across the board.
Adrish, how do you see the situation in Madhya Pradesh? Because we have seen it being one of the worst affected states. But when it comes to implementation policy and things like that, how is the ground situation at the moment?
During the second wave, I think COVID has penetrated deeper into the rural pockets. And our observation is almost every second or third household in villages, if you go there, you'll find symptomatic patients. Now, the challenge is in cases like these, the pre-existing healthcare infrastructure is already poor. It used to be overburdened anyway, and patients used to be referred to higher centers for better care, better management of patients. Add to that, the uptake of preventive measures in rural areas has been really poor. There might be some misconceptions involved for people living in the rural areas, given the election rallies that have happened, the examples that have been said by a lot of politicians. So the last few months have been actually disastrous in terms of uptake of preventive measures. People from the villages are very scared to get tested for COVID because they probably believe they have to go to quarantine centers, or the risk, or the economic risk that comes with home isolation. And such misconceptions have to be cleared. These tests have to be therefore provided door to door to improve the uptake of testing. And a lot of information, education, and communication has to be done regarding utilization of well-fitting masks.
And so let's now, in fact, get Dev Bhaktani Sri Krishna into the discussion. Now, what is this concept of hi-fi masks that we have been looking at? You've been promoting it also. And how helpful is this fight against COVID-19 by using these masks?
Hi-fi masks include N95 masks, but they also include other masks like from Korea called KF94, FFP2 in Europe, and some versions of KN95 from China. So these are already available in the market, but the usage is not universal. And I think this is the most important part. That means we are also absorbing all the things that are in the air. And COVID accumulates travels in the air, and then it accumulates in indoor settings, especially. Even outdoor possibly too, but more so indoors. And so in poorly ventilated areas, which most places in the world are, they're not very well ventilated. They are going to, the COVID, someone who's infected is going to breathe out this COVID all the time, and it'll start accumulating just like smoke. If someone is smoking in the room, how does the smoke start staying in the room, stagnating in the room? That's exactly what's happening with COVID, essentially. So as a result, we need to protect ourselves from this using these hi-fi masks, which we are calling hi-fi stands for high filtration and high fit. In fact, Germany has already done this. They have made it mandatory for everyone in the country to use these hi-fi masks whenever they are interacting with people in the public.
Could you, in fact, enlighten more on this? Because I don't think so. A lot of Indians actually have an idea about what is the kind of mask available and what is actually good for them. Because most of the times when we go to a place, we just ask for an N95. And yes, that's the only thing, or that's the only standard that we know about.
N95 is a US standard designed by the Center for Disease Control, National Institute of Occupational Safety and Health. And it is a very rigorous standard that goes all the way from the design of the mask to the manufacturing and the quality verification. So if you have a cloth mask, a lot of the small aerosol particles that we are exhaling and inhaling, they go right through it. You can't see them, but they're small enough, less than a millionth of a meter, and they'll pass right through it. Maybe at best 50% filtration in best case, more like 20%. Whereas N95 mask is designed to filter 95% of those particles across all particle sizes. It also requires it to be fit across the face, so it's not leaking around the sides. It's equally important. If you have an N95 mask and you're wearing it loosely, it does no good.
Now, when it comes to double masking, is it safe because a lot of people complain of feeling suffocation? They find that they're not able to breathe as easily as possible. But at the same time, that's the only way, is what a lot of experts are saying. So what about this double masking phenomenon, and why is it this instruction given out right now, especially during this COVID pandemic?
Yes, double masking is a stopgap concept. It is I think if you have access to N95 or KF94 or FFP2, I would immediately prefer those to double mask, first of all. Okay. If only you need to use double mask if you have nothing else available, and you must get something that will filter the particles. And even when you do it, it doesn't work as well. Real world tests have shown it filters in human subjects around 75% of the particles, which means that 25% are passing through, which is a lot compared to 5% of the N95. So, but in places where it's not available and you must do something right away, the concept is you need to take a surgical mask like this that fits. If it has a 3-ply surgical mask has some of the same material that's used in an N95 mask in many cases. So you put it on, and then you put a cloth mask on to make sure it fits tightly. So you're basically solving the problem in a kind of a ad hoc way. You're getting filtration with the surgical mask, and on top of that, you need to put a cotton mask to make it fit to your face. So it doesn't work as well as the other manufactured masks, but it's something you can try. And it's not, and also for breathability, it's not well engineered for breathability. These N95 masks are engineered for filtration and breathability. If you have nothing else, you can consider it, but better to buy a N95.
Let us go to, in fact, back to Dr. Dhillon. In Indian scenario, you see there is a lot of testing that is happening, but a lot of false results are also coming in. We don't know whether tests are happening properly also at times. We had a situation where a person who went to one testing center got a positive result, who went to another testing center got a negative result. So there's a lot of confusion with regards to testing as well. So especially, how do you look at the Indian scenario, and how can we streamline testing for better results?
There's different ways of getting tested and different testing modalities. So for example, RT-PCR, in a lot of times is considered what we call the gold standard. It will miss fewer cases, but there is a false negative rate with even RT-PCR. So every test comes with certain pros and cons. RT-PCR works well when you're trying to confirm diagnosis, so to be sure that the person is infected, especially when you're thinking about isolation, triaging isolation beds, and also thinking about administering treatments. Now, the thing is, RT-PCR cannot scale to the extent needed in a pandemic where many of the chains of transmission, if not most of them, are unknown. So, for example, we saw the same issue when we dealt with Ebola several years back, where Ebola, people talk about these symptoms of people having bleeding from the mouth and et cetera. But most Ebola patients don't have those symptoms. Most have fever, chills, something that sounds like malaria, pneumonia, other common illnesses that are there every day. So then the problem becomes, if you don't know where all your transmission chains are, then anyone coming with a fever could potentially have had Ebola. Now, the problem is RT-PCR, the challenge we faced with Ebola some years ago, RT-PCR could not be scaled to really screen all those people who had fevers who may be infected. Now, let's look at how that plays into the COVID scenario in India. You have transmission chains that are completely unknown. And the challenge with COVID is, additionally, it's not just people who have symptoms, even people who have no symptoms could be carrying the virus and breathing it out and infecting others. And so there's just no way RT-PCR is going to be able to scale to that extent. This is where other tests, such as the rapid antigen tests that Dr. Dreech mentioned, could be a huge game changer. These are tests that give you results very quickly. They do not require the specialized laboratory personnel and equipment that's needed for RT-PCR, and that limits the ability to scale it. And these tests can be deployed on the field. So you can train ASHAs, you can train even other community agents who are part of the government structure, or NGOs, or other groups operating locally, to then administer these tests. And like I said, even patients themselves can be trained to administer these tests on themselves. So these tests do have a little bit of a higher false negative and false positive rate. Now, the thing is, the false negative rate from the studies that have been done so far seems to be in patients who, generally speaking, are not as infectious. So the people who have higher loads of virus tend to be more accurately diagnosed by these tests. Second thing is, these tests work well. Like I said, you have people who have no symptoms who might be infected and not know it until they infect others who then become sick. So one of the values of this test is that if you can ideally do it every couple of days, even if somebody's false negative on Tuesday, when they retest on Saturday, you find out that they are infected and possibly able to infect others. So using it serially is one key. And then when you talk about false positive rates that are a little bit higher with these tests, that's something that can be offset by basically anyone who's testing positive. You either test them with another rapid test that targets a different antigen on the virus, or you confirm them with PCR. And so in this way, you can integrate these. No test is going to be 100% perfect for every situation all the time, but you take these modalities you have and you can create an integrated strategy. With the proper support and a clear strategy, testing can be expanded. But I think the key piece will be really getting rapid tests into the fold and scaling them up exponentially from what's being done now, because at this point we really need to be testing ideally almost the whole population on a routine basis. And we're very far from that. At this point, we're still catching just a fragment of the cases that are probably there.